Hello. Hello. My name is JGinnett, and I will be performing a presentation to present Pamela Pasquarelli's dissertation entry. Her entry is entitled Self-Reported Competence of Entry-Level Registered Nurses. This dissertation was submitted in August of 2017 for William Patterson University. Pasquarelli wanted to examine the self-perception of entry-level nurses' competency at the beginning of their first job in acute care setting. This was to advance the teaching, research, and practice of nursing through these types of inquiries, so as to facilitate change within the training of and development of the professional nurse. The significance of this research can be summed up by Watson and Hillman's 2011 article that states, quote, due to rapidly changing medical and technological advancements in today's healthcare delivery systems, nurses need to possess higher competency levels of skills, knowledge, and abilities to render safe and quality patient care, end quote. So Pasquarelli's research question was just that. What is the self-reported level of competence for an entry-level registered nurse, or RN, at the commencement of their first job? Okay, so first off, she chose a theoretical framework around competence. The Competency Outcomes Performance Assessment, or COPA model, derived by Lindberg, Klein, Abderrahman, Spencer, and Boyer in 1999, was the one that she chose. She chose this one because the pillars in the COPA model correlate well with the survey that was utilized in the study, and I'll discuss that in a minute. It then can be used as a basis to develop curriculum in nursing training or provide a foundation for competency validation in new graduate hiring programs in the hospital setting. It was necessary for Pasquarelli to provide a definitive definition of competence, and she also provided an in-depth review of the different methods of competency assessments that are available. Those might include, many of them include self-assessments, and actually probably a majority of them are self-assessments. And then there are more objective measures of competency, such as job performance evaluations, competency validation, and simulations. Pasquarelli chose a quantitative, non-experimental cross-sectional design. She utilized Nielsen's Nurse Professional Competence Scale. This is an 88-item self-reported Likert scale survey. The 8 factors within the survey are broken down into 2 themes. Theme 1 being patient-related nursing, Theme 2 being nursing care organization and development. She administered the survey during new employee orientation by all who fit the inclusion criteria and signed the consent form. This was a convenience sample. And these were from One Health Network system in the Northeast. There were 83 surveys collected, and all but one provided demographic data. Frequency graphs were included in her dissertation and completed for demographic data, as well as for each area of competence that was measured in the NPC scale. The Individual mean scores of each area were of a highest value of 3.1 and the lowest being 2.2, and these were out of that 1 to 4 point Likert scale. The highest mean values were in the theme of patient-related nursing, and all the lower ones were in the theme of nursing care, organization, and development, which was very interesting. When comparing the two based on the mean scores, it was obvious that the theme 1 with patient-centered nursing care was higher than the organizational developmental scale. There are other significant findings through the demographics that included the type of nursing degree reported, as well as any prior experience in a healthcare related field, not nursing. I should point out that if the new grad had any nursing experience prior to, that was an exclusion. What the results and the data analysis tell us is that the highest level of nursing degree gave us the highest levels of competence in all fields across both themes, but it was significantly, statistically significant. The same also held true with any healthcare related work while in nursing school. Pasquarelli deduced that this might be due to the fact that they were introduced to clinical cases or patient care, or even something as a soft skill of communication and empathy, which made learning other parts of nursing easier and better. The hope is that with this information, there can be a bridge for the gap through practice in academic settings and make that transition from academic settings into practice easier. Pasquarelli noted several limitations with her study. A convenient sample does not generate generalizability in results, and she pointed that out. She did note that one hospital in the study only hired BSN educated nurses and thought that that might skew the results for other types of nursing degrees in her study. She did not give a number of, the frequency diagrams indicated the percentage of BSN versus other degrees, and they were significantly higher. She was concerned about the time lapse from the time an RN first gets their license to starting a new job, indicating that more than half of the respondents had greater than 3 months between the time of licensure, greater than 6 months between licensure and their first job. And thus, with that long delay, competence, self-reported competence might actually skew downward. She did reiterate that self-reported data is subjective data and thus is not very strong in reliability or validity. And she did note that the survey used, the MPC survey that was used, was not developed in the US. This could potentially mean that different curriculum and scope of practice for the nurses in other countries could offset the reliability of that scale. Her recommendations were to perform a longitudinal study for comparisons of competence, maybe from the beginning of their first job to 2 years or even 1 year later. Stronger evidence and support and study of the effects of healthcare-related jobs while in nursing school. And she really wanted to assess competency at different points in nursing careers, whether that be at graduation or in different practice settings like a long-term care facility. The key conclusions she took away from this study was that the hope that administrators might put resources into new employee orientations, transition to practice programs, more structured new graduate programs with preceptorships, and allowing appropriate time, feedback, and reflection for the new graduate nurses. This is where I would take questions, but I will finish by addressing some important points of why it is important to include, or excuse me, to explain the following points in an oral defense. Each one of the items identified here, introduction, research, question, methodology, results, and conclusions, all require a strong understanding of a question or a hypothesis that needs an answer. The introduction has to give good insight into why this is important and any significance it might have. The methodology has to be a design that can answer the question appropriately. The results need to be analyzed and synthesized in depth and bring that right back to the research question in hopes of answering the problem and adding to the knowledge base around the topic. And lastly, the conclusion needs to be able to pull from all of this, and the doctoral candidate should be able to provide a cohesive conclusion from all the pieces put together. These are my references. Thank you very much.